I'm Dr. Rebecca Bowers, and in this video I'll be talking about something I call the ballerina exercise for the upper extremities, which is an exercise that encourages full active range of motion of the arms and opening up of the anterior rib cage. This exercise is safe for people in good health who are able to easily raise both their arms up over their head without any difficulty or pain. It might also be safe for people who have limited range of motion of their arms if a physician or body worker who is trained in giving stretching or exercise advice deems it to be safe. It should not hurt at any time while doing the exercise. And like most stretches and exercises, it works best if while doing the exercise you take slow, deep breaths to help relax the tissues. This exercise helps remind the nervous system that we need our arms to be able to move more than we usually use them throughout a typical day. To perform it, stand with your feet a few inches apart and move your arms in circles only as far as it is easy and comfortable for you to move them. If your shoulders tend to be slumped forward or you have increased kyphosis of your upper back, you may only be able to do small circles in front of you. That's okay, only do what is comfortable. There should be no pain. If you are able to make big circles, then as your arms come up and over your head, imagine the front of your rib cage relaxing and opening up. Now let's watch this exercise in motion so you can see what I'm talking about. The following video starts out showing what the circles might look like if someone has difficulty moving their arms, and then the circles gradually increase in size until the full range of motion circles are accomplished. Some things to keep in mind when doing this exercise. Only make circles as big as you comfortably can. Do not force it. If you're only able to make small circles, then that is what you should do. The nervous system should be gradually allowing more arm motion after days, weeks, or months of doing this exercise. So slow and steady wins the race in this case. You can do this exercise up to a few times a day, or if you forget or your schedule is too busy, you can do it a few times a week or whenever you happen to remember it. Now let's watch the video, but this time we're going to look at it from the side, and in this next video we're going to see what it looks like for someone who maybe has that increased kyphosis in their upper back where they're hunched forward a little bit and can only make small circles. And then we'll follow that up with another video showing what it might look like for someone that has pretty good arm range of motion, but who maybe spends most of their day not moving their arms very far and could benefit from taking their arms through their full range of motion regularly. I have made this video as a resource for other physicians, body workers, and my patients. While this exercise is safe for most people to do, some people have medical conditions that interfere with their ability to do some stretches or exercises safely. I cannot recommend that you do this exercise unless I have examined you, obtained a thorough medical history, and deemed it appropriate for your individualized healthcare needs.